And I would like to add one more thing, a case study that I'm aware of, an example where two states actually agreed to exchange with each other. This may fall into the point-to-point kind of agreement you were talking about, but they did it through the Health Information Exchange. So rather than having the agreement that was the NHIN DURSA to allow exchange between agencies in those two states, instead they both participated with a health information organization that, and all of them were party to agreement there. So there can be inter-organizational agreements that are not the NHIN DURSA agreement.
Thank you guys. Thank you very much. That kind of spurred something in my mind. Very rarely do I get out of the health IT domain, but I did. When health reform came out, I understood that some of the state's attorneys are actually challenging this new law, and it made me wonder about what recommendations we could make to policy, to the FACAs. Is there anything specifically necessary or beneficial that we could propose to the ONC or others that would simplify interstate exchange or make the exchange more robust in some ways? I don't know if that's a question that maybe our good friend Melissa could tackle or think through.
I'm not sure I can answer that.
Yeah.
Yeah, I think that's probably a great topic for another webinar.
The one thing I would say there, though, Aaron, is that there is collaboration going on among states in certain, there are regional groupings, there appear to be. So that the Southeast region has a group of states that are meeting and looking at collaboration on various issues. And I'm sure that probably the agreements between those states to share information, which could be through the NHIN or not, similar things going on in New England and around Colorado. So I would follow that. I mean, I guess that would be my recommendation, is to make sure that we tap into that discussion. It's very active. It's kind of grassroots, self-organizing to work together on issues and topics that are very useful. And I think to have mechanisms for receiving that input from those entities as they, those collaboratives as they move forward, and making sure that the NHIN is always receptive to that, and the FACA process is open to that, and not just reactively but proactively, I think would be a recommendation that I would forward personally.
And I think we started out talking about this, just starting a dialogue with all the folks, and I believe are we nearing the end of our time? We have 3 more minutes, so I wanted to try and just use the last 3 minutes to thank all of you guys very much. Thank you for really just starting the conversation, though. And NEHIC has a very fortunate position that we can help facilitate gathering questions from everyone here, everyone in the webinar who've submitted questions. We have not been able to get to all the questions that we got, but our process is to aggregate those questions and provide them to our partners at ONC and others. And I think that this might be one area where, like you were alluding to, Lisa, we can help facilitate folks just sharing information and commenting. So I'd be very personally, as the interim CEO of NEHIC, to hear from folks that would be interested in forming some kind of community like that we could support by making some tools available, and allow the different regional entities that are emerging and folks from within the VA and within the ONC who may not have all the answers. And that is, like, I've worked with the government for about 20 years, and this is the only agency I've ever heard said, we don't know the answers yet. And I think if we all can work together to get to those answers and create a community of sharing, that would have made this hour that you just spent with us talking about legal agreements very worthwhile. So thank you very much.
Thank you.
Thank you.